Hi everyone, I'm Jay Watson with Emory Healthcare. Thank you for your interest in Emory Telemedicine. Telemedicine is a convenient option that allows us to provide you timely and high quality care by replacing or supplementing your in-person visit with a video visit, also called a telemedicine appointment. This option allows you to get care from a convenient and private location, such as your home or office, while getting expert care from Emory providers. Also, please rest assured that if your visit is more appropriate for an in-person visit, our providers will convert your care to the most appropriate setting. We know you may have a few questions about your telemedicine visit, and we're here to answer them for you. So why don't we walk you through how it goes? A member of Emory's team will send you a link in an email or a portal message with detailed instructions. A member of your care team may even call you a few minutes before your scheduled time just to ensure that you have everything you need. And that's it. There's nothing more to do other than to wait for your care team to show up. Hi, Dr. Esper.
Hi, Jay.
Everyone, this is Dr. Gregory Esper. He is the Associate Chief Medical Officer of Emory Healthcare, and he's going to walk us through how our telemedicine visit will go. Dr. Esper, why should I consider a telemedicine visit?
Jay, with telehealth, we can continue to provide you with a high level of care that will empower you and your family. The continuity of care that you will experience with us is critically important, and we can provide high quality care from all of our specialties using telemedicine.
So Dr. Esper, once we're on camera, can you walk me through how the appointment goes?
During your telemedicine appointment, your provider will talk with you about your signs and your symptoms, and they will then examine you in a similar fashion that they would have examined you in person. They will identify a diagnosis and a treatment plan for you. While most things can be handled over video, if for some reason your provider thinks an in-person visit is necessary, they can bring you into the clinic and examine you in person. For surgical specialties, you may need to send in imaging or other documentation prior to your visit to help your provider give you the best care possible. My colleague, Dr. Matt Pombo, can share more details on that.
What we've been doing with telemedicine and the surgical subspecialties is, initially it was a little intimidating for us just because a lot of what we do is very hands-on and surgical. So, the adaptation of telemedicine in our practices has really been based on triaging patients and deciding who needs surgery still and who doesn't. We've found some great applications for our post-operative patients where we're just checking surgical wounds, starting physical therapy, or implementing other things that they need as part of their post-operative care. So it's been a great way for us at Emory to maintain communication with our post-surgical patients. We've started adapting it into new patients, and that's where a little bit of the challenges with telehealth come. We have developed some great pathways with Emory's teleradiology to help us upload images, and whether it be a CAT scan or an MRI, we're using the portal to get outside lab work. So we essentially are making this a more streamlined way for our patients to get information to us as part of their visit. And it really has just been quite amazing and really eye-opening to all of us in the surgical subspecialties, just because we took something that we all had a little bit of a doubt on of how we were going to use it in surgery, and it's really become an extremely important eye-opening tool for us that I think most of us have plans on using in the future and as part of our practices for here on out.
Thanks, Dr. Pombo.
So Dr. Esper, if I have an issue that needs to be addressed or I need a prescription or something, you can take care of that?
Yes. Our telemedicine appointment will provide the same level of care, recommendations, prescriptions, and further treatment plans that an in-person appointment would have. During your visit, your provider may ask you to provide vital signs like blood pressure and pulse using tools that you already have in your home.
Dr. Esper, is the standard of care the same that I would receive in person?
Absolutely, Jay. The standard of care is the same. Our goal is to provide the same quality of care that you would have received with us during an in-person visit. Your visit will be with the same nurses, the same doctors, or other health providers that you would have seen during a normal visit to Emory, except that it will be through video, using a smartphone, a tablet, or a laptop with a built-in camera.
Dr. Esper, I'm worried about how to do my telemedicine appointment.
Jay, there's no need to worry. Our team has worked very hard to ensure telemedicine appointments are easy to navigate. As you showed us at the beginning, we will provide you with step-by-step instructions and personalized assistance to make sure that you are prepared for your telemedicine appointment.
Dr. Esper, what about confidentiality? How can I be certain that everything between us stays private and confidential?
Jay, we take patient information and confidentiality very seriously. Zoom for Healthcare is a HIPAA-compliant program that is being used across Emory to help us interact and continue offering care to our patients. Your telemedicine appointment is not going to be recorded. It's not going to be shared with anyone outside of your care team. If Emory decides to use another platform outside of Zoom, you can trust that it is going to be HIPAA compliant, and patient safety and security will always be top of mind for us.
Thank you, Dr. Usper.
Thanks, Jay. We are excited to provide telemedicine visits to our patients and their families. We believe if your provider thinks that it's clinically appropriate, it is a wonderful option as a supplement and/or a substitution for in-person care.